How to help your loved ones overcome depression. For decades, mental health conditions like depression, anxiety or other chronic medical disorders are not discussed openly in the communities because of stigma, fear, and ignorance. Unlike physical conditions, mental illnesses, specifically depression, do not demonstrate any obvious symptoms and the conditions aren't that easy to diagnose or observe. People suffering from mental illness deliberately hide the symptoms, or they simply don't know that there is something wrong with them. On the other hand, the prevalence of major symptoms associated with depression can have an incremental effect if it is not diagnosed or treated on a timely basis. It can lead to a functional disability or leave you numb and exhausted if the symptoms remain unrecognized. According to extensive research studies, the symptoms of depression are mainly associated with hormonal imbalances, stressful events, and personality traits, a traumatic incident or unpleasant experiences at certain stages throughout life. To put the issue in perspective, it is critically important to understand that there is a number of treatment options available to help you or your loved ones fight major depressive disorders. The treatments range from medication or psychotherapy to drug-free alternatives such as transcranial magnetic stimulation (TMS). Risk factors for depression. Depression affects each individual in a different way and does not have any one-size-fits-all treatment. According to the National Institute of Mental Health, it is substantial to consult with your psychiatrist or therapist to help you or your loved ones to be correctly diagnosed and have a proper treatment plan. However, in the light of recent studies, the following are the most common risk factors associated with depression. Having a family or personal history of depression. Undergoing trauma, tragic life changes or stressful conditions. Undergoing physical illness, certain treatment and medication. Ways to overcome depression. It might take some time for your doctor to determine whether the symptoms of depression are caused by a medical condition or any other reason. That is to say, the suggested intensive treatment depends on the severity of your depressive disorder. Though taking antidepressants or certain medications with long-term therapies may have an optimal effect on the mental condition of the patient, there are several other alternatives you can opt for to treat depression. Above all, these alternatives do not rely on drugs or medication, so you don't have to worry about any long-term side effects. Drug-free depression treatment. Transcranial magnetic stimulation (TMS). This drug-free depression treatment is one of the most revolutionary methods in neuroscience as it does not require antidepressants or any other medication of the sort. The treatment is called transcranial magnetic stimulation (TMS), which is a clinically proven and FDA-approved therapy used medical facilities to treat people suffering from severe depression or anxiety. It is an effective treatment and incorporates electrical stimulation for your nervous system by using magnetic pulses. The process is similar to magnetic resonance imaging (MRI) that targets an inactive region of the human brain. The aim of TMS is to reduce symptoms of depression by controlling the mood elevation hormones of the patient. The approach also helps medical professionals enhance their clinical practices in the domain of neurology. How TMS works. The antidepressive properties of TMS work with different techniques. It involves an induction of intracranial electrical current, which is driven from the magneto-electrical device. Psychiatrists have observed vast changes in the behavior of the patients with a notable reduction in depression and anxiety. Not only this, TMS also helps to improve the symptoms of sleep disturbance that leads to abrupt mood swings. The process follows a simple three-step procedure and is equally well tolerated by patients. The TMS device is used to deliver magnetic pulses that help doctors stimulate different parts of the brain to control the mood of the patient. The device creates a clicking sound and a gentle tapping on the head and transfers magnetic pulses. The session requires 30 to 40 minutes. The patient can continue with his normal, daily activity after each session. Apart from all therapeutic treatments, it is vitally important to show your uttermost concern for the one who is suffering from depression. Your affection and influence can help him or her remain motivated and build a positive perspective towards life. Positive input in the form of attention, care, encouragement, and motivation helps a person suffering from depression and can also help alter a negative outlook on life. Thus, depression treatments like TMS can be made more effective with love, care, and support of the family.